Male infertility is a problem. It's a problem that we don't talk about. I want to open up the conversation on that, but the most positive message is there is a solution, and that's what we're talking about today. With me, I have here the most amazing, the one and only Vanja Duric, who is our senior scientist who runs the Monash IVF lab in the Sydney CBD, which is a purpose-built, state-of-the-art unit. Vanja makes the most amazing embryos, and I am so fortunate to be able to work with her. We have a very close working relationship. So let's talk about male infertility, and I can tell you what Vanja doesn't know about sperm isn't worth knowing. So a couple comes in to see me. I investigate both together. I investigate the woman and I ask the man to do a semen analysis. The sample is sent off to the lab where Vanja takes over. Can I get you to talk a bit about what you're looking at in the lab when you do a semen analysis?
Sure. So once you receive a sample in the lab, to perform a diagnostic test, there are certain parameters that we'll look at, and we're looking for sperm concentration. What we're looking for, the total number of sperm cells in the whole sample. Second parameter is sperm motility. We categorize sperm cells into motile.
So those that are moving?
Yeah, sperm cells that are moving.
And those that aren't.
And those that are not, so immotile sperm cells. The next parameter that we'll look at is sperm morphology. So that's where we assess the size and the shape of the individual sperm cells. So we look at the head as well as the neck of the sperm cell as well as the tail, and we assess each piece and grade the sperm cell as normal or abnormal.
And if I was just to talk about a few normal ranges, the lower limit of the normal range for the count is 15 million sperm per mil of semen. 15 million. So 15 is the lower limit of the normal range. For motility, looking at the number that move, it's roughly about a third. We say about 32%. We want to see them moving. And for morphology, it is normal to have 4% of the sperm that look normal and, in fact, 96% to look abnormal. And when any of those parameters fall below that, we can see a drop in fertilisation. So there's a couple of situations that we're now going to talk about. Firstly, the man who comes in where it's fallen only just below the normal range. It might be about 13 or 14 million. Some factors that certainly have positive impacts on sperm production would include addressing lifestyle. Critical here is going to be no smoking, no vaping, and cutting out alcohol, and I ask every man about that. I'd also ask about any intercurrent medical conditions. I would ask about the level of exercise that they're doing. If they're running ultra marathons or training for ultra marathons, we know that that can have a significant negative impact on sperm production, and addressing all of these lifestyle issues can improve the count and the quality of the semen analysis. It will go back to normal. Other factors that can have a positive impact on sperm production include antioxidants, so a diet rich in green vegetables, a handful of walnuts per day, and supplements like Menavit and coenzyme Q10. So Vanja, can you tell me a bit more about sperm production, the time frame, and when we repeat the test?
So when we do get an abnormal semen analysis report and the doctor requests to repeat it, we usually advise for the sample time frame to be anywhere between 2 weeks to a couple of months. It does take about 120 days, they say, for sperm cells to regenerate. So if the patients have the time and they can wait and they are available to repeat the semen analysis test, we absolutely do recommend it.
So the next situation is where the count remains very low, and we've gone through all the range of investigations. We can see that natural conception is not going to happen. We then have the conversation about IVF and how we can make all of this happen. It's at this point that I have a close and detailed conversation with my colleague Vanja about the things that she can do in the lab to make this all possible and make this come to life?
Yeah, so you do call me and we have a
All the
phone
time.
discussion regarding the sample and what can we do to help this couple create embryos.
So, Vanya, from the point that you have the semen analysis, and I'm going to give you a situation where there's just a few sperm there, maybe 10. What is the process then?
So if we do get a suboptimal sample, such as 10 sperm cells are seen, we would centrifuge the sample to ensure that we collect as many sperm cells as we can from that ejaculate. The next step is we would assess the motility, morphology, so the way the sperm cells appear, the motility of the sperm cells, are they moving or are they not moving? If they're not moving, we can do something about it.
The very positive message is that even with a very low sperm count, Vanya has amazing techniques to retrieve the sperm, special media that she uses. She can inject that into the egg that is collected and create a beautiful embryo. We certainly do know that age is a factor which has a negative impact on male fertility. And in particular, over the age of 45, we would see a decrease in the quality of sperm production.
We can freeze sperm just like we freeze eggs. They are cryostored in our tanks. It is much easier to freeze sperm cells than it is to freeze egg cells.
So there's a situation where a man comes in and there is no sperm that's found in the peripheral ejaculate. There are particular techniques that we can still retrieve very immature sperm. Vanya, would you like to talk about that?
Absolutely. The procedure is called surgical sperm retrieval, or a teaser. This is where your doctor would surgically retrieve your sperm cells, and scientists, we would process it in theatre and basically give the thumbs up to the doctor if we have found sperm.
It is done under general anaesthetic. It can take a couple of hours. A very fine needle is placed in the testicle and tubules are aspirated and then passed to the scientist in theatre. And then what happens, Vanya?
This is where we tease the tissues and try to locate the sperm cells. And then we basically let the doctor know that we have got sperm, and we take that sperm to the lab where we either prepare it for clinical use or we freeze it for future use.
It is an incredibly simple procedure to do a semen analysis. You could go to your GP and get a referral, and it would be absolutely routine. If a couple came in to see me for a fertility check, I would organise for the man to have a semen analysis. So I would say when a couple comes in to see me, about 30% of the time it is predominantly a male factor infertility that's leading to the issue.
I think from a male perspective, and we see a lot of our male patients and we do empathize with them. It is a quite challenging procedure to produce a sample on site in a sterile little collection room. There are challenges with that process. Sometimes it's okay if you cannot collect a sample in the room. You can go home and produce in your comfortable environment.
Vanya, why do you think that we don't talk more about male fertility? I mean, I can definitely say that there is a misperception that it's a woman's problem, and it takes two. It takes an egg and it takes a sperm.
Absolutely. We treat them both equally in the lab. So from the lab perspective, we don't think that we don't discuss male fertility, because we do. We pay attention to every single sperm cell, and we're very particular with which sperm cell we choose to inseminate and perform the procedure. So from the lab perspective, we talk a lot about male fertility.
There are some amazing photos of the point where they're taken from IVF, from the lab, where there's a single egg surrounded by several million sperm. I mean, the question is, you only need one sperm to fertilise the egg, but you need several million sperm to surround the egg, to release all the enzymes, to break down the outer layer, and then one gets in. And
this is where the egg shuts the door and goes, no more.
No more.
I got my sperm.
No more, I've got it. And you could go to a dark place in your mind when you think about that, because for all of us, we were all the winner of that race. We were all the first one that got there. Out of 200 million sperm in an ejaculate, our sperm was the first one that got there. Have you ever thought about why it was yours and not the one next door?
Do you want to talk about the World Health guidelines?
It is well accepted that male fertility is dropping around the world, and that's so we use the criteria that we use for the semen analysis that Vanja would use in the lab is called the World Health Organization criteria. The semen analysis has got to reach certain benchmarks, and it's been known for some years that the fertility rate is dropping in men.
The parameters every few years are changing.
They're dropping. Even like in the 15, 20 years that I've been doing it, they have brought down what is considered to be a normal semen analysis. One theory is the electromagnetic radiation. They have shown that men who carry their mobile phones in their pocket next to the testicle have a lower sperm count than men who carry them up higher on their waist, on their belt. That's been well shown. Another theory is in the food supply chain, the fact that animals are given hormones like estrogen and antibiotics, and that gets into the food chain. There's a lot about it that we don't know, but it is well accepted that male fertility is dropping, and it's something we need to talk about, and it's a message that we need to get out there. The things that we have control over are just what you do in your own life, isn't
Absolutely.
that right?
In your daily life, your nutrition, your intake, how you treat your body is a representation of your sperm sample on the day. So when you come to the clinic to produce a sample, we do ask you to fill out a questionnaire. So that's like a health questionnaire that gets reported to your clinician. So we do and the questions that we ask is your abstinence period. So, when was the last time you ejaculated? Some of the questions are, do you use sauna frequently, or hot baths or cold baths, and how frequent? Because that can have a little, could potentially have a little effect on your sperm production or quality.
Muscle building, like testosterone, is like a male contraceptive.
It's a no-go.
It's an absolute no-no. You've said to me before, if a man comes in and he's very muscular, you worry about if he's taking steroids and testosterone supplements.
Only if there is no sperm cells present. Because sometimes, I guess maybe due to shame or privacy, or you're not comfortable, you're not going to release that on your questionnaire, that you are taking testosterone or any supplements that could possibly affect your sperm health. But we will see, because the sperm cells tell us exactly about your health, and how you answer the questionnaire helps your doctor to guide her to help you achieve your pregnancy.
So the question is, if the semen analysis is suboptimal, is there a way to reverse it? If it is only just below the normal range, you tell me what you think about this, like count of 10 to 11 million, slightly low motility, slightly low morphology, with making positive changes to your lifestyle, cutting out cigarettes, smoking, addressing diet, a diet rich in antioxidants, stopping recreational drugs, a semen analysis like that could improve. In a situation where it's very low, a situation where there's 1 million sperm or maybe just isolated sperm, the environmental impact is not the big thing going on there. There may be an underlying chromosomal problem which is not going to be impacted by significant life changes. But there's positive news there. Vanja, with all her amazing techniques in the lab, can
all
still...
the bells and whistles.
Absolutely. We offer all the bells and whistles. We can still make beautiful embryos.
And this is why we are here. This is why IVF exists, is, for cases like these, surgically retrieved sperm, zero sperm cells seen, and the initial look at the sample, we can do something about it.
When I get a result back from the lab and it's abnormal, I am very conscious that I have to be very careful in how I communicate that news to the individual man, because he's probably not expecting it. He's expecting a normal result. I am very careful with how I say that, and very supportive. And I have to say, at the end of the day, we have to be positive on messaging, because there are things that can be done about it. You don't need to be scared of an abnormal result. There are positive things that we can do about it. Vanja, I've loved talking to you today, like I always do. It's been great, and it's all been, hasn't it? It's been part of opening up the conversation on something we don't talk enough about, talking about male fertility. Thank you so much for your expertise and
My
time.
pleasure. Thank you. Thanks, Jenny.